This training video will demonstrate the method used at Menlo Park Fire District to secure a patient to a backboard. There are many acceptable methods to secure a patient to a backboard, but having one method used by our personnel will eliminate confusion and streamline patient care. We will start by assuming the patient needs full C-spine, has a cervical caul correctly placed on the patient, someone is holding manual C-spine, and the patient has been properly placed on a backboard. Circulation, sensory, and motor skills have been assessed on the patient prior to a full C-spine package. A headbed can be placed under the patient head at any time while the patient packaging is being performed, but do not secure the head until after the straps have been placed. You will need 5 backboard straps, a headbed, and some 2-inch tape. Let's start at the top of the backboard by large-footing a male portion of a strap to a backboard handle around the area of the patient's armpit. We want this strap to be below the shoulder so that when secure, it will prevent the patient from sliding up the board. Secure the second male portion of a strap to the opposite side of the board. It is important to use a male strap in this position because if a female strap is used, the buckle will end up in the middle of a patient's chest, causing discomfort. Next, place 2 female straps through the separate handholds at the location of the patient's hips. Do the same on the other side of the backboard. Next, you will connect a male section of the strap to the backboard handhold at the position of the patient's knee. Do the same on the other side of the backboard. Next, connect one of the male straps from the shoulder area to the lower of the 2 female straps by the hip on the opposite side of the board. Repeat this with the other male shoulder strap. Have the patient take a deep breath and snug the straps. Next, connect the male strap by one of the knees to the upper female strap by the opposite hip. Repeat this with the male strap by the opposite knee. Snug up these 2 straps. Next, take your last strap and secure both the male and female straps using the lark's foot technique to 2 adjacent backboard handholds on the same side of the backboard by the patient's ankle and lower leg. Pull the male strap over to the opposite side of the board through a backboard handhold and back over to the female buckle. Snug up this strap. Now that the body is secure, place the headbed under the patient's head if it has not been done. Finally, use the padded Velcro strap that comes with the headbed over the patient's forehead and secure it to the headbed. Lastly, secure a piece of 2-inch tape under the backboard around the level of the patient's ear, up and over the patient's forehead. This may cross over the headbed strap and back down to the opposite side of the board where you will secure it to the underside of the board. Check circulation, sensory, and motor skills on the patient following patient packaging, and if necessary, place a blanket over the patient. The patient is now ready to be moved to a gurney for transport. Thank you for watching. This concludes our review of patient packaging.